Hi there everybody, my name is Lyle Schemmerling and I'm about to do my presentation on Recondo technology and their business intelligence in practice. Alright, so what is Recondo technology? Recondo technology is a software as a service company. They provide products that allow healthcare providers to estimate patient financial responsibility, benefits, and eligibility before, during, or after their time of service. I'll read you a quote just straight off of their website, which says, "We help hospitals streamline the revenue cycle by moving operations upfront, reducing manual intervention, and delivering operational and financial benefits. Our sophisticated rules, architectures, and legacy integration and data mining provide true interoperability for more than 450 U.S. hospital customers," directly from their website. That means is they allow you to see insurance benefits for a patient when they show up to schedule their appointments at the hospital, or when they show up to have their procedures done at a hospital, and not 2 months later when an insurance company gets around to responding to their benefits requests. We'll get more into that here in a minute. Let's see, the healthcare revenue cycle. This is about as simple of a diagram as I can make, or as I can find of this, which basically talks about how hospitals get paid. It's not a simple matter of, you show up to get a massage, you pay for your massage, and they give you a massage. You show up at the hospital, and they take down your insurance information, schedule with the doctors, make sure that everything is approved, see what your benefits say you are eligible for, find out what your copay is, your co-insurance, what your total responsibility will be. Are you in network or out of network? There's a lot of things that happen, and so there's a whole cycle associated with this that ends up being, they schedule you, they will admit you, they will give you your procedures, and then they will bill you and your insurance company, to try and get paid for the services that they have provided. It's a bit messier than most other industries, a bit more complicated. Also happens to be, especially in this country, one of the industries where the most money circulates around, so it's kind of a big deal to make sure that this whole process goes smoothly. The trouble with getting paid as a hospital or as a healthcare provider is that you don't always know if a patient is eligible for the benefits for the procedures that they are asking for, when they show up to the hospital, and oftentimes neither does the patient. They may have their insurance card, they may know kind of what their deductible is, but it'll be really hard for them to say that every little thing that they're about to do is going to be 100% covered by their insurance company. It's sometimes hard to figure out what their financial responsibility, I'll call that the PFR from now on, is going to be. Like I said, there's co-pays, there's co-insurance. How much of the bill are they going to pay? Are they going to pay that now? Are they going to pay it later? And then there's the insurance companies, and they also can be stingy about paying the bills. They can deny claims for didn't have the correct referrals, they weren't at the correct hospital, the reasons for getting the procedures weren't valid, although they might have covered them otherwise. A bunch of different things can come into play. And the healthcare providers, the hospitals, in this process, in the healthcare revenue cycle, stand to lose a ton of money just off of not getting paid for the procedures that they provide. One of the biggest sort of causes of waste in the healthcare industry right now is sort of, the money that is lost over procedures. The details of that, how much money are hospitals actually losing, is the system that we have right now the best one out there? Subject of great debate and the topic for a different presentation than this one. So moving on. 3 P's you kind of need to know if we're going to talk about what Recondo does a little bit more. One is the patients. That's pretty simple, the people receiving the procedures. At the end of the day, they're the ones who got the procedures done, and they're the ones who will end up, being responsible for the cost of the procedures that they had done to them, especially if their insurance company doesn't cover it. Speaking of those guys, those are called the payers. We'll call Medicare, insurance companies, anyone who might help foot the bill for that, PFR for the patients and their procedures. Those guys are going to be called the payers, and anyone who is providing those procedures, anyone who is billing somebody and, owning the cost of those procedures. Those are the providers. Those are the ones who are at risk of losing money if nobody decides to pay their bills. Alright, so the benefit of knowing your benefits. It is much better to have an idea of what the patient financial responsibility is before the procedure is performed. You need to be able to collect the patient financial responsibility at the time of service or set up a payment plan. It's a much better way of getting paid than trying to get, a bill paid 6 months later after people are all nice and healed up. And then know if a procedure is not covered before it is performed. If you decide you're going to give someone, a surgery and it turns out their insurance company isn't going to pay for it and the patient can't pay for it, well, guess what? You're out of luck as a healthcare provider in terms of getting paid for that service. And, same thing for knowing if referrals are needed in advance. So Recondo has a bunch of different products, actually, that sort of help address these issues. All of them use business intelligence, and I'll get more into how it's sort of the core of what they do in a little bit. But 4 of the big ones that they use, one is AuthDP. Now this is a service that allows a healthcare provider to see if a procedure that they want to perform will require an authorization or referral from, the general care practitioner or specialist for that patient before they get the service done. This will help reduce the amount of claims that a payer will deny in the future. A very big deal in terms of saving a provider money. Eligibility Plus allows you to look at just sort of the overall coverage a patient might be eligible for from their payer, their insurance company. Basically gives you a snapshot of what you can and cannot do procedure-wise with a patient if you're the payer or provider, rather. Another big one is called SurePay Health. This is one of the more sort of direct ones, allows a healthcare provider to basically get an estimate of what that patient's financial responsibility will be at the time that they show up at the hospital for their service. So it allows them to sort of see all the data that you've collected about sort of the healthcare benefits, about the procedures, about the patient themselves, and calculate out based on the healthcare provider's rates for the services that they do. Calculate out how much is that patient going to owe, whether that's from their co-pays, whether that's from their co-insurances. You've got patient deductibles on a lot of their insurance plan. You've got sort of an out-of-pocket limit, which sounds like a deductible, but it's not quite the same thing. And all of those things can come into play. Different rules involved. Are you in network? Are you out of network? A lot of those different things. If you're a hospital and you want to get money from a patient first, know that you've at least padded yourself from losing some money right away. You can use SurePay Health to calculate out, okay, man, here's what you're going to owe by the time you're done getting all of your procedures. Why don't we get that payment process started now? It's sort of a huge deal. And then one more is called Claim Status Plus, and this allows a hospital or a provider to, they've done procedures on a patient, they've submitted a claim to the insurance company, they want to see what the status of that claim is, they want to see what the status of them getting paid is. Being able to, directly interface with the payer and see what that is can save a lot of headache between sort of the denial process, the arguing process, and where is my getting paid. I think something that maybe a lot of people don't realize, the process of getting a healthcare provider paid for a procedure can take months, sometimes, more than a year after a procedure is performed to see a dime come back from a patient or a payer in terms of those services, and this introduces a huge area of risk for that healthcare provider, and one of the areas that sort of knowing in advance tends to really save them a ton of money. Okay, so what does Recondo do to provide these services? Well, you're going to need a lot of data. In order to be able to calculate out what a patient's financial responsibility is, what the, authorization requirements are for procedures, benefits information for a payer or a patient group as a whole, requires you to be constantly collecting information about all of these things, being able to store it and pull it back out in a meaningful way that the healthcare provider can look at and really use intelligently, to further their business. So there's a couple of different things. One of the big ones is called recon bots. So these are essentially fancy web crawlers, very sophisticated web crawlers, which will go out. A lot of payers, a lot of insurance companies will have website portals, whether for patients or whether for the healthcare providers, where they can log on and, using a set of demographics information or information about a patient, look at what those benefits may be, look at what they're covered for. Can they have an MRI? How much are they going to have to pay for the MRI? What is their co-insurance? What is, their deductible? And a provider wants to be able to go in and look those things up, but it's a pain to have to go in and look it up every single time you have a patient show up in your office, in your waiting room, and be able to tell them what their financial responsibility is going to be. A recon bot goes out there and it pulls that information from those portals and collects it so that when that patient walks in, all you have to do is punch in, some information about them, and it will return all the information for you. Another big one, HIPAA has actually created a standard for insurance benefits requests. They're called the 270-271 EDI requests using the 5010 standard. That is a lot of numbers and a pretty complicated way to explain that this is basically what a healthcare provider can use to send an electronic request to a payer, and the format that electronic response should come back in. Nice standard way, easy to read, same way every single time, so there's no confusion and discrepancy there. Unfortunately for the providers is that this information can often be a lot. Very detailed information, sometimes very hard to read information. Great for computers to go out and collect, very, very difficult for humans to use. And then a lot of healthcare providers have their own information systems. Hospitals have their own computer systems, their registration software, information about, the services, the costs, the amount that they have been paid or that they need to be paid for a service. Recondo has the ability to go in, interface with those hospital systems, and pull back all of that data, combine it with their own, use that to then provide some more meaningful data about patients, about, sort of the payment status and things of that nature. I can't talk too much about this. Now, I do work for Recondo. I am an intern there. I do a lot of hands-on stuff with their databases. I can tell you that they have a lot of databases that they use to collect all of this data. They structure it in ways that make it pretty smart to pull that back out and load into their products and show to the healthcare providers in a meaningful way. Some of the best ways to visualize data possible for the types, amounts, and importance of the data that we are seeing here. Can't get a little too specific on this, though. I don't want to be stepping on any trade secrets or sort of giving anything away, so I've been asked to sort of be vague on some of those more internal points. But as we all know, we know how data can be structured in a database, how it can be pulled out and extracted. Recondo definitely has their ways of doing that. Alright, the benefits of business intelligence to Recondo. So as I said before, they are a software as a service company, and their software would not be what it is without the data that they provide. So the service here really is that they've gone out, they've collected all of this information for those healthcare providers, and they are there to give that back to the healthcare provider. They are there to show them the information that they want to know, that they need to know right away at some of the most critical points in the healthcare revenue cycle, so that they can, at the end of the day, get paid, save money, reduce the cost and the overhead in the healthcare industry altogether. As a service, it saves the provider's money, it saves the patient's money and headaches, and by saving the hospital's money that they would otherwise lose on not getting paid, should end up driving the overall cost of healthcare down, one would hope anyway. The nice thing about being Recondo in this day and age is that there's not a lot of competition out there right now for this type of service. There are other companies that handle benefits information, that aggregate it, that help provide it to healthcare providers, but there's nobody that quite does it in the way that Recondo is doing it, and no one that has quite that holistic approach of, I've collected all of the information about a patient, about their financial responsibility, about benefits information, payers, and how they relate to the hospitals and their contract rates, that Recondo does. So it does give them sort of the ability to really dive out there. They were a startup until a couple of years ago, very recently ranked highly in a number of rankings for software companies around the Denver area, just for being innovative in what they're doing. They do have some challenges in the way that they get their business intelligence, though. Getting data from those payers can be difficult. As I said before, a lot of the payers have their own website portals that people can go to look up patient financial responsibility, benefits information. They're all different. So in building those recon bots, you have to be able to make them adaptable, make them able to read what are sometimes complex, vague websites and pull meaningful data out of them that can be used to perform the calculations that Recondo does for the healthcare providers. The EDIs that we talked about before, those 270, 271s, are good standard, and whenever those can be used, unfortunately, they are sort of on a patient-by-patient basis. And what you really want to do is sort of get that data wholesale, so they might interface with the healthcare provider systems that I talked about before. They might interface directly with the payers' systems and sort of the information that they have about their coverage and the benefits that they provide. Again, none of those systems are standard. They're all going to be different between everybody else. So sort of taking all that data, converting it, aggregating it, and making it into one standard data type can be quite the challenge. And then things change. Payers change their policies. Insurance companies change their policies. Hospitals will change the rates. They'll change the procedures that they provide. They'll change which networks they belong to and which payers will pay to them. And of course, patients change their benefits and their eligibility all of the time. You change jobs, you change, you get married or divorced or have a kid, can change the level of eligibility that you have for a number of services. And so keeping track of all of this data can definitely be a gigantic challenge for the company. Another one is sort of knowing all the rules. As I've talked about, there are a lot of factors that come into play here. The networks, reasons for visits, referrals, demographics, the different types of coding that is used for procedures, the amount a hospital is charging for it, the amount the insurance company actually has to pay for it, the amount the patient has to pay. There's just a lot of things that are, there's a lot of data here. So being able to organize it and sort through it and collect it and bring it back in a meaningful way is a big deal for Recondo. Another one is HIPAA. So we've talked a lot about being able to go and look at what a individual patient would sort of have their eligibility, have their benefits covered for by a healthcare payer and provider. That information can be very sensitive. A lot of times you're talking about insurance account numbers and sometimes procedures that many people would like to be kept private, and all of this information is very sensitive. HIPAA makes a very, very, very big deal about making sure that a patient's privacy is protected. One of the biggest challenges you face when dealing with this amount of data is making sure that the privacy of the patient is protected above just about anything else. Okay, so a couple of discussion questions here. Recondo has a great tool for healthcare providers, as I've talked about, but how much can a patient benefit? There's a lot of data here. We've talked about how it can be good from one perspective, but given the nature and the amount of data that I've talked about that is being, gathered and used, probably a great way for patients to be able to sort of see for themselves, to be able to shop around for insurance, or for healthcare providers, and knowing, sort of what their insurance is and get it covered, and really make some intelligent healthcare decisions themselves. On that note, will knowing the true cost of healthcare change the way that people seek out healthcare services? So if I know that if I go to the general hospital down the street, it's going to cost me $2,000 to get an MRI. If I go to the smaller radiology clinic that's just a few blocks away, and they only charge $900. Am I going to be, shopping around? Am I going to be going to the hospital? It might change the behavior that people exhibit quite a bit in the way that they shop for healthcare. Alright, thank you so much. Here are my sources. I hope that I was at least interesting in talking about Recondo technology and the services that they provide and the business intelligence that they use. Thank you very much. Again, like I said, I am an intern there as well, part of why I have such respect and experience for this company and the stuff that they do. Thank you.